Good evening and welcome to Montgomery Heart Wellness. And we have a great discussion today. We're going to be talking about atrial fibrillation. And I'm going to get into the nuts and bolts of what causes atrial fibrillation and how you can really not only prevent it, but even reverse it. And there's some natural things that you can do to help control atrial fibrillation. But first, I want you to understand what it is, how we manage it, the important aspects of managing atrial fibrillation, and how you can understand what your cardiologist or internal medicine doctor may be recommending and why they recommend the things they do. And of course, you'll be able to ask intelligent questions. So let's get right on into it. So overcoming atrial fibrillation. First of all, knowledge is power. And so we're going to start overcoming atrial fibrillation by understanding what it is. Essentially, atrial fibrillation is an abnormal electrical disorder. It's a rapid, disorganized electrical circuitry that starts in the upper chamber. The upper chambers of the heart are known as the atria. And when these chambers fibrillate due to an electrical storm, if you will, we call it atrial fibrillation, the fibrillation of the atria. It overrides the normal organized heart rhythm. And so instead of your heart beating in a normal organized way, a normal rhythm, and a normal rate, it beats in a disorganized, chaotic manner. And so it can be associated with symptoms of a rapid, irregular heartbeat. Oftentimes people refer to it as palpitations. However, sometimes individuals don't feel palpitation. They may feel other things such as chest discomfort or shortness of breath or onset of fatigue. So they can have a lot of different manifestations. So here is a little diagram that shows an EKG tracing. And you see these little spikes. Each spike represents a heartbeat. And so you can see these spikes are very close together and they're a little bit erratic. And you see the little wiggles between the spikes, very erratic. That's atrial fibrillation. And normally you should see a normal rhythm. This spike here represents an electrical shock. We call this a cardioversion. And then you see the rhythm going to a normal rhythm, a small beat. This is the atrial signal, ventricular signal, repolarization, atrial signal. So this is a normal organized rhythm compared to atrial fibrillation. So there you have the basic aspects of atrial fibrillation, disorganized atrial arrhythmia, and it starts from the upper chamber. So what causes it? Well, essentially the underlying cause of atrial fibrillation essentially are the similar things or same things, if you will, that cause other physiological and biochemical imbalances. Like other chronic illness, increased inflammation, oxidative stress, a disrupted microbiome. These things lead to the pathophysiological or the abnormal physiology that leads to atrial fibrillation. So your lifestyle behavior is a major contributing factor. We're going to talk about some specifics of lifestyle, but you have increased what we call reactive oxygen species. These are just simply toxins. They lead to cell and tissue damage. That creates a production of pro-inflammatory cytokines, increases inflammation, and that's an ongoing cycle. So this happens in other chronic illnesses, but especially in atrial fibrillation. So there's a toxic trigger. Now, we frequently see in most people poor diet and no exercise. However, there are other things that can trigger inflammation. Certain foods you eat, certain chemical agents you may take in, whether it's a medication or drug that may trigger inflammation and oxidative stress that can bring about atrial fibrillation. Certain immunizations that can trigger inflammation and cause atrial fibrillation. So you get this trigger, whether it's poor diet, exercise, or some other cause, and it leads to oxidative stress, inflammation, and of course here's fibrosis, that's scarring. The more you have this biochemical fire, the more scarring you get. That leads to abnormal electrical activity in the upper chambers. You can also have abnormal electrical activity in what's called the pulmonary veins. And those are the blood vessels that send blood from the lungs back to the left atrium. And so they can get increased electrical activity and have what we call ectopic firing or lots of abnormal signals that contribute to an abnormal electrical signal. So again, you're setting off a firestorm inside your heart. So who's at risk? Well, anyone with chronic illness. If you have diabetes, high blood pressure, obesity, heart failure, cardiomyopathy, these all chronic illness contribute to atrial fibrillation. If you've had cardiac surgery before, or valvular disease, or coronary artery disease, or sleep apnea, these are medical conditions that contribute to atrial fibrillation. But of course, alcohol, there's a condition that we used to refer to in medical school as holiday heart syndrome. Individuals go out and binge drink, and they'll have arrhythmias that trigger atrial fibrillation. Certain drugs can trigger atrial fibrillation. And of course, hyperthyroidism is a common cause of atrial fibrillation. Former President George H.W. Bush presented with atrial fibrillation, and he was found to have hyperthyroidism. Notice the largest bulk of causes for atrial fibrillation are the environmental causes, chronic illness, prior surgeries, toxin intake, and family history and age and height. These have a much smaller impact. So that's important to know. The majority of what causes atrial fibrillation are the things that you can control, and that's actually good news. What bothers us about it? What are the problems with atrial fibrillation? What are the things that we're concerned about as cardiologists? Well, you can have complications on two basic areas. A big one is stroke, okay, or other kinds of thromboembolism. Stroke is an embolus to the brain, but you have emboli to the lungs, kidneys, intestines. You have emboli to the heart. You have a heart attack because blood clots can go from the left atrium to different parts of the body, or the right atrium to the lungs or other parts of the body. You can have swelling in the lungs, pulmonary edema, dementia over time. This could be due to strokes, small subclinical strokes, or it can also be due to progressive deterioration of the brain due to poor blood flow with atrial fibrillation. And then, of course, ventricular fibrillation, individuals who have atrial fibrillation for a long time, it can cause what we call a tachycardia-induced tachycardia, lots of ischemia, and someone with coronary disease can go into ventricular arrhythmia as well. So how do we treat atrial fibrillation? Well, our target treatment in the allopathic space is to look at the potential risk. And so there are different approaches. We want to control the heart rate because most people with atrial fibrillation, when they go into atrial fibrillation, the heart beats very fast, 150 beats a minute, 200 beats a minute. So we may give you medications that prevent the rapid heartbeat. There may be also medication that prevents you from going into atrial fibrillation. We call these antiarrhythmic drugs. So they can decrease, the onset of atrial fibrillation, help the heart stay in sinus rhythm. And of course, the big one is stroke prevention. So you may start patients on anticoagulants. People refer to them as blood thinners, warfarin, aspirin, and some of the direct oral anticoagulants that we use now. So the treatment is in three major prongs: rate control, rhythm control, and stroke prevention, which all are very important. Stroke prevention is definitely the big one on here. The management can be very complex. Stroke management, of course, you have the antiarrhythmic drugs, rhythm control. The anticoagulants, the stroke management. The rhythm control is anti-arrhythmic drugs. And of course, access to care. Individuals who go in and out of AFib, sometimes they have to go get cardioverted. You have to be under the care of a cardiologist or at least an internal medicine doctor who's going to follow you very carefully. So this is a chronic problem that has to be managed over time. However, there's another treatment for atrial fibrillation, which actually has been found to be perhaps the most effective. And they did a study. This slide is from a study where they did atrial fibrillation ablations, is a procedure to do where you can prevent the formation of atrial fibrillation based on a catheter burning procedure. And they used ablation by itself, and it had some AFib ablation, but it didn't have so much success. There was an increased need for repeat ablation. However, you take these same individuals who had the catheter ablation and you put them on a healthy lifestyle, they lost weight and they had reduced atrial fibrillation symptoms, reduced atrial fibrillation burden. They had improved comorbidity, so that diabetes and high blood pressure and things got better. And then with lifestyle modification alone, even without the ablation, you had less need for ablation, improved comorbidity. So lifestyle plus ablation was better than ablation alone. And of course, lifestyle change alone was better than ablation and lifestyle, and better than, of course, ablation alone by itself. So the lifestyle intervention has been shown over the years to be have a major impact on controlling atrial fibrillation. So what are the lifestyle mechanisms? Well, it gets to the heart of the problem. You have patchy fibrosis, inflammation, altered platelet. These are the things that are happening inside the atria due to increased stress, increased wall stress, reentry due to patchy fibrosis. So you got the inflammation, oxidative stress causing scarring. And so the lifestyle modification puts out the biochemical fire and reduces all of these adverse parameters that lead to atrial fibrillation. So you're really cutting to the source. If you give you a medication, we're not giving the information. I give you an anticoagulant, I'm not giving the information. I'm really covering up the underlying problem, or I should say I'm just covering up the manifestation of the underlying problem, and I'm not addressing the underlying problem. That's why most antiarrhythmic drugs fail after a year of use, because the progression of atrial fibrillation has to do with the progression of increased inflammation, increased oxidative stress, not the fact that you're given a medication that slows the heart rate down or theoretically controls the rhythm. So, so optimal health is really what you want to use as a source for controlling your atrial fibrillation. So what do we do in our practice? Well, patients who come to us with atrial fibrillation, depends on how sick they are. If they're very sick with heart failure, I may give them an antiarrhythmic drug. I usually use amiodarone. It's probably the best antiarrhythmic drug. And I'll start them with that. I'll start them also on a nutritional detox at the same time. So I'm reducing inflammation, reducing oxidative stress with the diet. We may add other therapies such as liposomal curcumin. We may add other therapies such as ozone infusion. All these things reduce inflammation, reduce oxidative stress, and it allows the heart to heal. If the patient remains in atrial fibrillation, I'll take them to the hospital, do an electrical cardioversion. So once they cardiovert to sinus rhythm, with a little bit of amiodarone on board and the nutritional detox, they stay in sinus rhythm. And then over time, I wean them off the antiarrhythmic drug. As long as they stay with aggressive lifestyle intervention, we may use anti-inflammatory supplements to help out. We have great success in keeping people off of drugs, on reduced drugs, and to a large extent, controlling atrial fibrillation. Of course, every case is different. Every patient may require, some drugs or more drugs than others, but we've had great success in reducing the need for excess medications. And we've had, in some cases, patients who are very good at following the nutritional regimen. We follow them over a long period of time and we watch them maintain sinus rhythm. And after, say, a year and a half or two, with their consent, they come off antiarrhythmic drugs as well. So I hope this was very helpful to you. And what I want to say is, of course, if you're new to the channel, please subscribe. You're going to get more educational videos like this. And of course, all of you should hit the thumbs up button, give us a like, and share with anyone that can benefit from this. And of course, I want to hear from you. If there are medical issues or questions that you have and you want to learn more about, please drop it in the comment section. Actually, I look at those comments and I use a lot of those suggestions to come up with future ideas for future shows. So I hope you do that, and I hope you enjoyed the show, and please share and like. Until next time, you take care, and y'all have a great rest of